To your health news this morning, a really exciting new in-home treatment for Alzheimer's patients, making some pretty big waves in this area after trials of results just released show that this thing reverses memory loss. So bioengineers are behind this one. Take a look at that cap. It's a head cap with 8 emitters that emit electromagnetic waves directly into the brain. And what they're trying to do is disturb the pathology for Alzheimer's. So they're trying to throw that plaque or the buildup in there off course here. The company behind the device says 8 patients are part of the trial. They wore it an hour a day for 2 months, and they did see improvements that have never been seen before. The patients, who were all over the age of 63, actually returned to memory levels of a year ago. Makers of this technology believe it will work on people at any stage of this disease.
So far, there has not been a drug that has been shown to stabilize this disease, much less reverse it. And over the short period of time that we administered treatment, we got a reversal of the cognitive impairment of this disease. I'm not aware of any drug that has been able to do that.
So what's really interesting is this treatment can be administered by caregivers at home because it's not a medication, it's just a cap. So those who participated in the study, they all got MRIs, and those showed evidence of increased communication between the neurons in the brain, and that improved cognitive abilities. So this is pretty exciting stuff. The company plans to do a bigger clinical trial of 150 patients. Again, right now they're just doing 8, and those patients will have mild or moderate Alzheimer's disease. That is set to happen later this year. So if they have similar results in that study, makers of this head cap plan to ask the FDA to make it an approved treatment for Alzheimer's disease. So really interesting that it's not a pharmaceutical, it's a cap. And I actually talked on the phone to a husband of a patient using it. He said it's incredible what it's doing for her.
Wow. So obviously it's very early in the trials.
Very early.
If it were to move forward with the FDA, I know you said it's treatment, would it be preventative as well? Have they talked about that?
They haven't talked about that. Right now they're using it for mild to moderate of the disease, but I think if you're at a higher risk of this, I don't see why it wouldn't be. You'd be able to use it. Basically, there's different proteins that build up in the brain, and then when they get together, that's what they believe is causing the Alzheimer's. So they're trying to break up that connection and not allow Alzheimer's to do what it wants to do.
Could you imagine if this moves forward
No.
and is one day?
Oh gosh, because we all know somebody or family or friends.
Yeah, I mean, my mom has had it for a
exactly.
decade. So it's like, it's just exciting to see that they're kind of thinking outside the box a little bit, and they're not just saying, take a pill or do this. It's like, well, let's try other ways of attacking this. And again, the husband I spoke to, he goes, she is only allowed to wear it an hour a day. She wants to wear it more. She can remember where they went to dinner. She can remember things she couldn't remember a year ago.
That's really promising.
So it's very exciting to see what happens, because this has been a big unknown for a long, long time. Today is World Alzheimer's Day. Right now, 50 million people currently live with some form of dementia, and nearly